Hi, this is Peggy Gunter from Aspen. Video 3 of our commercial blended tube feeding series is the use of commercial blended tube feeding products in the home patient.
This section focuses on the home patient and what are the indications for using a commercial blend for tube feeding. As a reminder, commercially prepared blenderized tube feeding, which is also referred to as CBTF, is defined by Aspen as a formula manufactured with food ingredients or pureed foods, and these formulas may or may not have added vitamins and minerals. Blenderized tube feeding offers several meaningful benefits for patients beyond just nutrition. First, it's been shown to improve gastrointestinal tolerance. Patients using blenderized tube feeding often experience less diarrhea, constipation, and reflux compared to those on standard commercial formulas. There's something about the thicker viscosity of BTF that may actually help slow gastric emptying, and that can help support better digestion, and also the viscosity can help reduce reflux. Second, BTF is often preferred by patients and caregivers because the use of whole foods feels more natural and less processed. And this idea of having some agency in the type of nutrition they take in can improve satisfaction and support long-term adherence. Third, the variety of ingredients in BTF can help diversify the gut microbiota. A more diverse gut environment, we know, is linked to better digestive health and even broader health benefits. Finally, there are real psychosocial benefits. Many families report that BTF helps restore a sense of normalcy and control. Patients have a sense of agency about the nutrition they take in, and this can positively impact quality of life as well as emotional well-being for our tube-fed patients at home. Blenderized tube feeding practice recommendations published in 2023 address enteral feeding access and make some recommendations. First, they state that gastrostomy tubes are preferred, but we do know that nasoenteric, gastro-jejunal, and jejunal tubes may be considered with the use of the commercially prepared products. When it comes to jejunal feeding, typically we're using a feeding pump, and that can cause some problems with home blends because of the hang time. It can make things very inconvenient to have to change the formula, a home blended formula, every couple of hours. So commercially prepared blends actually solve that problem and allow the hang time to be extended. And that can make pump feeding with a commercial blend through a jejunal tube very feasible. Lastly, they mentioned that a 14 French or larger tube is preferred, but we do know that smaller tubes can be used with good care and technique. And we do know that some of the manufacturers have tested their formulas with smaller tubes, as small as 8 French tubes, with success. Since we're on the subject of enteral feeding access, let's do a quick review of short-term feeding tube options. Nasoenteric feeding tubes are available between 5 and 10 French. Generally, a 5, 5.5, or 6 French tube is used in a neonate or infant. Our adults will use 8 or 10 French. They come in single port options like viewed here, but they're also available in dual port options. And this is nice for patients who are pump feeding because you have an extra port for flushing before and after medication without having to disconnect from a feeding pump set. We have several options for long-term enteral feeding access, and these tubes range between 12 and 24 French in size. Seen here is a standard profile non-balloon gastrostomy tube. Non-balloon refers to the internal retention device. Seen here is a soft silicone bolster that's used to keep the tube in place on the inside. Outside, we have a removable feeding port, and these will sometimes be referred to as PEG gastrostomy tubes. This is a balloon-style gastrostomy tube, and the balloon, which is inflated with water, is used to keep the tube in place from the inside. These also have external bolsters to stabilize the tube, but the port itself is not removable. This is all one piece. Low profile tubes, or buttons, also come in these two different options: non-balloon, seen here, and a balloon style low profile device. Again, the French sizes of these tubes range between 12 and 24 French. When a patient requires jejunal access, the gastro-jejunal feeding tube is an option. And I wanted to walk you through this tube because there's some nuance to the French size of these tubes. But first, let's talk about placement and access. These are placed gastrically, and the French sizes are generally 14 to 24 French, and it's referring to the outer portion of the tube. There's an inner lumen of these tubes that feeds down into the small intestine, and this is what allows us to bypass the stomach with feeds and feed directly into the jejunum. But these distal portions of the tube, the jejunal access, is smaller French than the 24 French that is displayed on the outer portion. So keep that in mind when you're thinking about putting blends through a gastrojejunal tube, that the outer portion of that tube, that French size, is going to be much bigger than the inner lumen with the jejunal access. This is also a gastrojejunal feeding tube, but it doesn't have the gastric access. So this tube is also placed gastrically, but that distal portion of the tube is fed down into the small intestine. And because it doesn't have that additional lumen, the French size that's noted on this tube is the actual French size that you're dealing with for your patient, and something to keep in mind when you're thinking about putting a thicker formula through the tube. This is the low profile version of the gastrojejunal tube. Again, the gastric portion of that tube is a larger French size. It can range up to 24 French. That internal lumen can be as small as 9 French with some of the tubes.
Now let's discuss some benefits of commercial blenderized tube feeding in the home setting. Every family is different, which is why it's great that we now have so many options for enteral feeding. When talking about commercial blenderized tube feeding, some benefits are that the family can eat together and the formula can be given at meal times. As I mentioned before, there is great variety in formulas that we have, so food variety is still possible with the commercial products. And lastly, due to the convenient packaging, it can be taken anywhere, making travel and just day-to-day life easier. To recap a few things from video 1, when it's time to get their feeding ready, here are some tips. Start with a clean workspace and gather all of the supplies you will need, such as your formula, syringes, administration bags, a towel, and a measuring cup. Formulas are best tolerated at room temperature, and adding additional fluids may or may not be needed. This really varies depending on the administration method and the formula chosen, as well as the clinical situation. Remember the hang time of the formula that you are using before you get started. There are different methods of administration in the home. However, syringe push method does work the best. It requires some strength. O-ring syringes may be easier to push compared to syringes that have a full rubber stopper due to the decreased stickiness. They may last longer, but if you do have a syringe with a full rubber stopper, dipping the tip in oil may help them work easier. Syringe pour method doesn't work very well with thicker blends. Administration bags are another option for administering commercial blenderized tube feeding. Reusable feeding pouches or direct access devices shown here are a good option, as well as gravity bags. Large bore gravity bags do work best. As you are likely aware, there are multiple feeding pumps out there, including some newer ones, and they can be used to administer some of the commercial blenderized tube feeding products. I recommend that you check the manufacturer guidelines for your specific pump because it does vary by pump brand. However, it is difficult to maintain a shorter hang time with a pump, so be aware of the hang time of the product that you are using. Likewise, accuracy can be variable with different pumps and may affect the feeding times and the ability to achieve nutritional goals. Many parents and patients do complain about frequent pump alarms when it comes to using a pump. So again, these should be used based on the clinical situation.
For patients receiving blenderized tube feeding at home, it's important to understand the different reimbursement categories that these formulas fall into, and I'll cover that next. Formula options that incorporate whole food ingredients now span multiple categories, reflecting significant innovation in enteral nutrition. And understanding these different billing codes is essential in the home care setting because this is how we communicate with insurance companies about what is being dispensed. And each code corresponds to a specific product category and carries a distinct reimbursement rate. So let's start with B4149. This is the original code designated for blenderized whole food or whole food ingredient formulas. And these include intact protein and represent the foundation of real food enteral options. Next, we've seen advancements in the hydrolyzed peptide formula category. For adults, this is represented by B4153. And we now have formulas with whole food ingredients available in this category. For pediatrics, the equivalent hydrolyzed peptide code is B4161. And again, there are now whole food-based options available to support children that require this type of formula. Lastly, the disease-specific category, which we code as B4154, there is a diabetic formula option that also includes whole food ingredients. It's important to note that some insurance providers view these codes as higher level formulas and may require additional documentation for the justification of coverage.
Patients want to be empowered and want to be involved in their health care. So having a backup plan is a great way to do this. While many commercial blenderized tube feeding products are available online, rarely are they available in a local retail store. Things happen, such as shipping delays, back orders, weather delays. So it's great for a patient or their caregiver to have a backup plan, such as a home blend or something that can be purchased locally in case their formula doesn't arrive. The recommended follow-up for someone who's on a home blenderized feeding or commercial blenderized feeding is every 1 to 2 months until the patient is stable, and then every 4 to 6 months after that. Lab monitoring should really be based on the clinical situation, not on being on commercial blenderized tube feedings. And without the support of a dietitian or a nutrition support professional, there's a potential for increased harm and risk of inadequate nutrition, poor weight status, and electrolyte imbalances. There are so many positive cases about patients who have transitioned to blenderized formulas, whether that be home blends or commercial blends. But this is a case of a 45-year-old female who was started on a milk-based formula in the hospital and for many weeks just complained about reflux and bloating and having loose stools, just overall not feeling well. So when she transitioned to the home setting, we decided to use a plant-based commercial blenderized tube feeding product that came in a pouch, and she used syringes to administer this. Very shortly after starting the new formula, her GI symptoms of bloating, diarrhea, even the reflux started to subside, and she couldn't have been happier with the change. Two things that she did notice though, that she needed more syringes with using the commercial blenderized product compared to when she was on the standard milk-based formula. And it was a little messier, but she thought that that mess was worth it.
And here are the references for this video. This educational offering was brought to you by Aspen. It was co-sponsored by Functional Formularies and Real Food Blends. Real Food Blends is part of the Nutrition North America family of brands.